Hello, my name is Abigail Davis and I am a student nurse here at the University of South Alabama. Today I'll be performing my medication administration checkoff, and this is my badge. All right, and then I'll get Hannah to pan the room. Okay, so the first thing that we're gonna start with is washing our hands. So we're gonna perform hand hygiene. I'm also going to ensure that I'm in a no interruption zone. So I'm gonna make sure that the doors to the medication room are closed. I will not be conversing with colleagues and I will not have my phone in the room. The next thing that we're going to do is verify the patient care order form, and we're going to compare it to the medication administration record, which is the MAR. So we're going to start with the 7 rights. I'm going to start with right patient. So Jaguar J. Jones, date of birth 8/25/1963, date of birth 8/25/1963, medical record number 4176352. Medical record number 4176352. The next thing we're going to go to is the right medication. So I know I'll be giving Novolin R regular insulin. Novolin R regular insulin. The right dose is going to be 10 units and then 10 units over here. The right route is going to be subcutaneously, and then I also see that it says subcutaneously over here. The right time is going to be 30 minutes before meals, and it also says 30 minutes before meals on my MAR. The next thing we're going to do is the right indication. So we'll be assessing and monitoring his blood glucose levels. So the next thing we're going to do is I'm going to look at the allergies on the patient care order form. I see that he's allergic to penicillin. And on my MAR, it also states that he's allergic to penicillin. All right. The next thing that we're going to do is pick the right drug. So I'm going to pick out my Novolin R regular insulin, and I see right here Novolin R regular insulin. The expiration date is 12/1/2025, so I know that it's still good. And here we go. All right. After this, we're also going to check the time. So 30 minutes before meals, it's approximately 30 minutes before Mr. Jones is set to eat, so I know we are in the right time. I'm also going to look at the right route, so subcutaneously. With that being said, we're going to pick the right syringe. So I'm going to go with the 0.5 milliliter insulin safety syringe. We're going to go ahead and take that out. All right. With the insulin safety syringe, I'm also going to note that insulin is measured in units. My syringe is in units, so I do not have to do any further conversions or anything like that. After this, I'm going to go ahead and take an alcohol prep pad. I'm going to clean the top of my vial. All right. Then I'm going to take my needle, take the cap off. Since we're doing 10 units, as seen right here, we're gonna go ahead and get 10 units of air into the syringe. As you can see right here, 10 units. All right, after that, we're gonna go ahead and insert the syringe into our vial. We're gonna go ahead and push the air into the vial and tip it over, and now we're gonna insert 10 units of insulin into our syringe. You're gonna wanna make sure that there are no bubbles. All right, after this, we're gonna go ahead and put the safety on. I'm gonna check again just to make sure. 10 units, 10 units. And then also, since this is insulin, I'm gonna get another nurse to come in and check my dose. So I'm gonna show the 10 units. All right, after this, we are gonna go ahead and I'm going to create a tag for my syringe. So on the tag, we're gonna do the drug name, the patient's name, and then also the dose. So I will be writing Jaguar J. Jones, Novolin R regular insulin, and 10 units. Okay. Then we are going to place this on the syringe. I'm gonna make sure I don't cover up the numbers so I can still see what I'm injecting. After this, we're gonna go ahead and do the 7 rights again. So we're gonna be comparing the syringe, my vial with the MAR. So we're gonna go right patient, Jaguar J. Jones, date of birth 8/25/1963, medical record number 4176352. Then we're gonna go to the right medication. So I know I'm supposed to be doing Novolin R regular insulin, which is on my vial, Novolin R regular insulin. And I know I just drew up what was in this vial into the syringe, and it also states on the name tag that it's Novolin R regular insulin. After that, we're gonna assess the 10 units. So I do have 10 units in my syringe. The right route subcutaneously, this is a subcutaneous insulin syringe. And then the time, 30 minutes before meals, it's approximately 30 minutes before he is set to eat, so we're good there. And then the right indication is to monitor his blood glucose levels, and there's still no documentation up to this point. Once we do that, we are set to go to the patient's room. So I'm going to take my syringe and my vial and the medical administration record, or medication administration record. All right, once we get to the patient's room, I'm going to knock on the door. I will go ahead and perform hand hygiene. I will introduce myself. Hello, Mr. Jaguar Jones. My name is Abby Davis. I'm gonna be your student nurse today. So what we're gonna be doing, I'll be injecting your insulin 30 minutes before your meal, if that's okay with you. All right, after that, we're going to go ahead and check the 2 identifiers. So I see Jaguar J. Jones, Jaguar J. Jones, medical record number 4176352, medical record number 4176352. We're then gonna assess for any allergies. So I see that he's allergic to penicillin. He also has an allergy band that says he's allergic to penicillin, and then I'll go ahead and ask him again just in case. So Mr. Jones, do you have any other allergies that we should be aware of? No? Okay, great. After that, we're gonna go ahead and do a pre-assessment. So I'm gonna assess his blood pressure, his respiratory rate. I'm also going to assess for any pain or abnormalities, anything like that. And then I will do these 7 rights once again. So I'm gonna go ahead and check the right patient. We just did that, but Jaguar J. Jones, date of birth 8/25/1963, date of birth 8/25/1963, medical record number 4176352, medical record number 4176352. After that, we're gonna do the right medication. So Novolin R regular insulin, Novolin R regular insulin, and that is what's also drawn up in my syringe with the name tag on it. After that, the right dose, so 10 units. I have 10 units in my syringe. After that, the right route, subcutaneous. I have a subcutaneous insulin syringe. The right time, 30 minutes before meals. It's 30 minutes before his meal. Right indication, so we will be checking his blood glucose levels. All right, after that, we are gonna go ahead and raise the bed to a working height. I'm going to lower the side rail. After that, I will be placing my gloves on. As well as my goggles. Okay, so since it's an insulin injection, I'm gonna go ahead and pick the insertion site. So I'm gonna do the abdominal insertion site. After this, I'm gonna go ahead and I'm going to assess the skin to make sure there's no bruises or lesions, abnormalities, anything like that. I'm gonna be pinching the skin to make sure I can either do 2 or 1 inches, so that determines if it's 2 inches, I'll be inserting it at 90 degrees, 1 inch, I'll be inserting it at 45 degrees. I'm then going to clean the area with my alcohol prep pad. So I will be going from the inside to outside in a circular motion. Okay. From here, I'm gonna go ahead and get my syringe, take the safety off. Since I can pinch 2 inches of skin, I'll be injecting at 90 degrees. So I'm gonna go ahead and inject it. I will be going slowly with it. All right, I'll be placing a little bit of pressure. I'm gonna put this into the sharps container. After this, I'm going to make sure the patient is in a comfortable position. We're gonna go ahead and raise the side rail back up, lower the bed, and then at this point, I will be taking off my gloves, throwing them in the trash can. And now we will be documenting how the patient tolerated the procedure in the MAR. We're also gonna be assessing the skin to make sure there's no adverse reactions. After that, we're gonna go ahead and that will be the right documentation, and then I will be checking in on the patient periodically. And that completes my checkup.